Hello, hello. Good afternoon again. Happy Thursday. By now, you all know who I am, Dr. Maisha Claiborne, and I help doctors and medical professionals create profitable businesses from what they already know. And so, welcome to day 4 of our week 3 of our series, Doctors Thriving Outside the Box Beyond COVID. And for those of you who are just joining us for the first time, you may by now know that I've been hearing a lot of chatter in the various groups, in my various communities, given all that's going on from docs and medical professions who are wanting to step outside the box and wanting to get outside of the traditional pathway and create coaching and consulting and integrative medicine and cash-based practices. So I decided to start this series over the month of April to give a foundation for what you need to be thinking about when starting these various practices. So week 1 was telemedicine, week 2 is cash-based practices, this week is integrative medicine, and we're coming up on the conclusion of this week. If you want to watch the previous ones, you can find them directly on my YouTube channel. And you can also find them in the various groups that I post in. So if you want to find them, if you can't find them, if you want them, just tag me in the comments and I will send you the direct link to those, as well as we'll send you some other goodies that I've been producing as a result of these live broadcasts. So now, before we jump right in, for those of you who are listening to me live on YouTube, go ahead and hit the subscribe button so you can stay updated on all of the various tips that I release on these live broadcasts that are going to be released. Whenever there is one, you can get notified. And you can also get notified of whenever I release a mind remapping empowerment vitamin. If you're live with me today on Facebook, go ahead and share, like, and share this with someone who you think it would be valuable for. Because we all know that there are a lot of our colleagues, a lot of docs that are ready to move into a new direction. So I want to make sure that I get this to as many of my folks as possible. So as you know, we've been talking about this all week. Integrative medicine is one of my favorite topics to talk about because it is my clinical background. I'm a family doc by training, practiced integrative medicine for many, many years before I transitioned into what I do now, which is coaching physicians and medical professionals, helping them start their business and helping them transform their mindset to be entrepreneur ready. So day 1, we talked about distinguishing the type of integrative medicine pathways. And day 2, we talked about discovering and uncovering your integrative medicine personality. And yesterday, we talked about the potential educational pathways that you can take. And so today, I want to really talk a little bit about services, the types of services you can offer with integrative medicine, because it's so vast. And, as I think about all of the potential services you can provide in integrative medicine, I think about when I first started my practice, and as a family doc, we treat from the womb to the tomb, so it's like full spectrum. Well, in the realm of integrative medicine, like it's kind of like that. It can be very broad spectrum, and sometimes when we think about moving into this sort of subspecialty, if you will, we can get caught up in trying to do it all. So I remember when I was starting my own practice, I was interested in everything. I wanted to do herbal medicine. I wanted to do acupuncture and the whole traditional Chinese medicine. I wanted to do coaching. I wanted to do homeopathy. I mean, just like all of it, like aromatherapy. I was like enrolled in the whole bit. And that's just, a few of the things. But there's only one of us. And so you have to take the path one step at a time. And one of the reasons I asked you yesterday, day before yesterday, to choose your integrative medicine personality is because that determines where you'll start. So for me, when I started my first practice, that's my second practice. When I started my practice in integrative medicine, I chose acupuncture and nutrition from a traditional Chinese medical perspective as my first tools to integrate into the practice, because those were the things that most drew me. I was very much a lifestyle person, as well as into energetics and the way acupuncture moved the energetics of the body. And so I started with acupuncture. And it was really great that I did that, because then once I felt that foundation was stable, then I could expand my reach, and I expanded into coaching. And then that was a natural expansion as a result of people being on my acupuncture table and telling me all their stuff, and me sort of naturally coaching them. So I thought I better get trained for that, right? And so then I expanded. I then expanded out beyond that then I started to get into more regenerative stuff like bioidentical hormones. It became a demand. I got pulled in that direction. And so there were a lot of things that I ended up expanding to, but I started with one or two or three particular services because I wanted a full-on wellness center, right? And a lot of docs dream of that. A lot of docs that I speak with, they dream of having this big full-fledged wellness center. And there's nothing wrong with that. But when you're first starting out, it's really best to start with what brings you the most fulfillment and expand for there. So you don't get yourself into a situation where you have so many things on your plate, or you're trying to promote so many things that promotes confusion with your potential patients. So, you want to think about starting in a particular domain and expanding from there. And I can tell you, when I started my practice, and I tried to do everything at first, because again, I had that dream, look at this big wellness center. And it made it really hard for me to market my practice, because patients didn't know what to choose. They didn't know exactly what I did, the value of what I did. So when I narrowed my focus, it actually allowed me to attract a specific group of people. And it didn't mean that I stopped providing the other services. It just meant that I marketed in a particular way, right? And that brought me my ideal patient. And then having provide this narrow focus for a period of time, I got really good at it, which means that patients referred. And then I was able to expand. Patient will come in and say, well, do you do this? And I think about it. And I think, is that something I want to do? Something I want to get trained in? And then I would add it on. So this is probably the thing that made the biggest difference in my practice, and that makes a big difference with the students that I coach, with the docs that I coach, because they really know what they're focusing on. And when you know what you're focused on, you're better able to communicate your offerings with the people that you most want to take care of. And then you can, once they come in, you can provide them with the most comprehensive services when they get in the door. But you, want to be clear about what you want to put out there in the beginning, so that you don't overwhelm yourself or overwhelm patients. Because when you give people too many choices, guess what happens? They don't choose at all. All right. So what is that for you? What are the services that you're most attracted to? What are the modalities that you're most attracted to? And if you don't know, and it bids exploring, and you have questions, then maybe we should talk, because I have lots of answers. So, that's what I want to know. Post in the comments. If you're already an integrative medicine provider, I'd love to hear from you as well. I've had some integrative providers actually comment what was the way that you were able to narrow your focus and then expand out, right? And for those of you who are thinking about it, what do you think would be the first things that you would want to provide as services? All right, what are those? Post in the comments. Let me know. Post your takeaways from today's lesson. And so we have distinguished a lot this week about integrative medicine. And, it's really the tip of the iceberg. I mean, we started out with, just distinguishing the integrative medicine pathway itself and with the various parts of the pathway. And then we went into what's your personality. Then we talked a little bit about, how to approach your educational pathway. And today, how to approach the kind of services that you offer from the beginning. And, my recommendation is always to start low, go slow, right? Just to start small, and expand from there. I think we are taught that we have to do it big. We have to spend hundreds of thousands of dollars on big spaces and buy buildings and things like that to start a practice. And if you're starting an integrative medicine practice, it's not necessarily that way. In some ways, in some practices, yes, you do have to spend that money. There's equipment, there's things to buy. But in a lot of ways, depending on what you choose in integrative medicine, you don't have to start so big. I started in one room inside of another wellness center. I grew to 2 rooms, and then I grew to where I had a full-fledged office space of my own. And that's how I successfully grew my practice in steps. So like I said, we distinguished a lot this week. It's the tip of the iceberg. And if you're super serious, if you're like really thinking about stepping out into starting your own practice, stepping out, especially if you're wanting to do integrative medicine, whatever specialty you are. I love seeing the specialist step into integrative medicine, and you need sort of like a guide or a pathway. Then I invite you to reach out to me and get on my calendar and let's talk. And you can see my calendar by going to drmaisha.com/meet me. It's right there on the screen. It's not clickable, but you can actually just put that in your URL and you can see my calendar. You can get on and you can talk with me, and we can look at, what it is, what it looks like for you to create that ideal practice. And I also invite you all, those of you who are interested in dipping your toe in the water, to check out the Med E University's Business by Design membership. So this is a comprehensive startup marketing sales curriculum housed inside of a low monthly membership. I've taken all of my curriculum that I typically use with my one-on-one and my mastermind clients, and I've put it into this nice little membership. And you can get a 14-day free trial by going to MedEU. That's medeu.nextlevelphysicians.com. And I'll put that link in the description in the comments so that you can check that out and get your free 14-day trial. All right. So post in the comments. I want to know, I want to hear from you, and let me know what it is that you need. What questions do you have? What are your takeaways from this post? And what's next for you? How will you move the needle forward? It's been a pleasure and a joy to talk about integrative medicine this week. And guess what? Next week, we have one more week left in April where we're talking about starting your own businesses. And next week is my second favorite thing to talk about, which is coaching and consulting. So you stay tuned. Next week, we'll be talking about that. Tomorrow will be more of a recap. So if you want to get a feel, if you missed the first 3 days, there'll be some recaps. We'll do a watch party so you can get to see what it is that we talked about earlier this week in integrative medicine. All right. Look forward to seeing you next week. Have a wonderful rest of the day, a wonderful rest of the week. Stay safe, stay well, and I will see you soon. Namaste.